Hi, Mr. Kelly.
Yeah.
My name's Chris Hilton. I'm one of the psychiatrists.
Hello.
I'm led to believe that there have been a few problems with your landlord and with your rent.
Yeah.
I've been asked to talk to you a little bit about that, if that's okay.
Fine.
I wonder if you can tell me, what are the problems?
I owe him money, and I've been forgetting to pay him rent.
So forgetting to pay him rent and you owe him some money?
Yeah.
Okay. Can you tell me a bit more about how that's come to be?
Well, I've lived there for 6 months, and he gets some money from benefits for rent, but I still have to pay him some money, and it's that bit I've forgotten. I haven't arranged it. I didn't think it was so important, but it is important, and I'm not sure what I should have done, but I need to pay him. I owe him money now.
Okay. So I'd like to go into some more specific questions about how this has arisen and how we might be able to help you with it.
Right.
Can I just ask, previously you were seeing the doctors here because I understand they said that you had paranoid schizophrenia, is that right?
Yeah.
Yeah. How is that at the moment?
I think it's the best it's been. Things aren't happening like they used to, and everything seems a lot quieter and manageable.
So things seem to be fairly stable from that perspective.
Yeah.
And tell me a little bit about where you live.
I live in a shared house, myself and 2 other people. We each have our room, but we share the living room and the kitchen.
Okay. Are they friends of yours or flatmates?
They're flatmates.
They're flatmates. Okay. And how long have you been there?
6 months.
And before that?
I was living with my mum.
Okay. So things are fairly stable with your mental health, it seems, and for 6 months you've been living in this new place, having previously lived with your mum.
Yeah.
Can I just ask a bit about your money?
Yeah.
So, thinking about money coming in,
Yeah.
where does your money come from?
I get some disability work allowance, and I work in a bar, and I do shifts there, and that's where my money comes from mainly.
Okay. So when you get your work in the bar, do you know roughly how much you earn there?
Depending on how many shifts, if someone's not well, they'll ask me to do extra. But it's about £170 a week.
Do they pay you that in cash, or do they put it straight into a bank account?
It goes into my bank account.
Okay. And in your job, are you handling money? Are you taking money from customers?
Yeah, all the time.
Have there been any problems at work with that?
No, I make sure I'm very careful about that, and it's very important. So, no, there's been no problems.
Okay. And you mentioned you're getting money going straight into your bank account. What about your benefits?
That they go into my bank, apart from the housing benefit, that goes straight to the landlord.
Okay. And do you know roughly in total how much money you get each month?
No.
Not sure.
No, I'm not sure.
Okay. And the money going out, how much money are you supposed to be paying to your landlord on top of the housing benefit?
£150 a month.
£150 a month?
Yeah.
And have you been paying any?
No, I've forgotten to do it. I haven't done it.
Why not?
I never got round to organising it, and when I did remember, I never seemed to have any money. And he was getting rent anyway, so I didn't think it was a big deal for him. And I was going to pay it to him. I just kept on forgetting and never really got round to sorting it out.
Okay, so there were 3 things there. You mentioned that it was a bit hard to plan for that and you were forgetting.
Yeah.
But also when you did remember, you'd run out of money.
Yeah.
But also you weren't quite sure how important it was because he was getting your housing benefit.
Yeah, I mean, there were lots of things that had happening and I had to do, and I thought I'll leave that one.
Okay. Can you think of a way that could have been organised so that you didn't have to remember?
I suppose maybe ask the bank to do something.
Okay. Have you heard of a direct debit or a standing order where it could get taken automatically?
I've heard of those terms. I didn't know what exactly they do, what the differences are.
Okay. And what do you think the consequences might be of not paying your rent? What's going to happen?
Well, he's going to kick me out.
You think you'll get kicked out?
Yeah, he's said something along the lines.
And how would you cope if that happened?
I could go back to my mum's, but I don't want to go back there. I wanted to leave. I mean, it's going to be a right pain, and I'd rather not. I quite like it there.
And you mentioned that this has been a problem recently. How were you managing before?
Well, I lived with my mum, and she did everything. She arranged everything.
So she did everything with your money?
Yeah.
And you were living with her?
Yeah.
Did you have to pay money to her?
She got some, yeah, but I don't know how it worked. She organised it. She just said she's getting money on my behalf. So I'm not sure what. You'll have to ask her.
Does she help you with any of your money now?
No, that's one thing. Why I wanted to move out. I wanted to do things myself and pay my rent myself.
Okay. A couple of minutes ago, we talked about one possible solution. I just wonder if you could remember what that might have been, how we could stop this happening again.
With the bank? Get the bank to do something?
Do you remember what we discussed?
You said things like standing orders and the other one, which I don't really know the difference between, but it's money going out without you having to remember.
Just kind of to help me gather my thoughts, I think your mental health problem seems to be quite well managed at the moment, and I think that you do understand the problem that's arisen. I think that you can sort of weigh up that it's risky not to pay your rent because you might find yourself homeless. And we had a discussion in which I asked you to remember things, and I think your memory's not impaired. I don't think there's a problem with your memory, and you can clearly communicate very well. But I'm wondering if there's more we can do to help support you and educate you about how you manage money, so that moving forwards this doesn't happen again.
Yeah, thanks.
Thank you. So in this station, we're asked to perform a financial capacity assessment. And the way I chose to approach this is to think about it as with any other capacity assessment. That is to say, thinking about whether this man has a current mental disorder. In his case, he's previously had schizophrenia, but it seems currently to be well maintained. I didn't want to focus too much on going through a full history or mental state examination because that's not the focus of this station. But a couple of screening questions shows that I'm looking for anything that might be impairing his capacity. I then wanted to think about the 4 domains of the mental capacity test, that is to say, testing his understanding, his ability to retain, his ability to weigh in the balance, the pros and cons of making decisions, and his clear ability to communicate. I guess the conclusion here is that this gentleman does have some difficulties managing his finances, but on a day-to-day basis, he's working in a bar, he works with money regularly. The difficulty for him, as with many people, even those who don't have mental illness, is that he is very inexperienced when it comes to managing his finances. He's impaired in his capacity to budget, and this might be something we can support him with.